Hi friends, welcome to PharmaGrid. So today we are going to continue with the remaining patient profile based type of clinical oriented questions. So starting with the first question, a 44-year-old black male is brought to the emergency department with 6 hours of worsening lethargy and confusion. Past medical history is significant for EC bruising, 3 months of bone pain and frequent pneumococcal infections. Labs were ordered revealing serum calcium of 17 mg per deciliter. The normal value is about 9 to 10.5 mg per deciliter. To rapidly lower his serum calcium, you administer calcitonin. However, calcitonin alone is insufficient because it is known to rapidly and suddenly lose its effectiveness within 2 to 3 days of repeated dosing. For this reason, a bisphosphonate, which takes 2 to 3 days to become effective, is added simultaneously. So what is the term for the rapid decrease in response to calcitonin? So the options are anaphylaxis, prophylaxis, tachyphylaxis, tolerance. So here the correct answer is option C, that is tachyphylaxis. Tachyphylaxis describes a scenario in which the response to a drug rapidly decreases. Difference between tolerance and tachyphylaxis. Tolerance comes from the target cells or tissue modifying its physiology to compensate for the effect of a drug. Tachyphylaxis occurs when something disrupts the drug itself from functioning, such as internalization of receptors or uncoupling of signal transduction. Now let's see why the remaining options are wrong. Option A is anaphylaxis. It is a manifestation of type 1 hypersensitivity reaction mediated by mast cells and preformed antibody. It does not lead to a decreased response in a drug's action. Then option B, which is prophylaxis, it refers to measures taken to prevent disease rather than treat disease once it occurs. It does not describe changes in response to a drug. Then option D, which is tolerance. Tolerance and tachyphylaxis both refer to a decreased response to a drug, but tolerance has a slower onset and relates to changes in physiology to compensate for the drug's effect. Moving on to the next question. A 21-year-old man presents to his primary care physician complaining of a single painless ulcer on his penis, which he first noticed a few days ago. He admits to multiple sexual partners. You want to treat him for syphilis with penicillin G, but his history includes an itchy rash following amoxicillin treatment as a child. What must first occur in the body for a penicillin to become allergenic? The options are: first pass metabolism in the liver creates a toxic metabolite. Then next option is it must bind to a larger molecule resulting in a complex that the body sees as a foreign antigen. Option C is nothing additional needs to happen. Simple exposure to penicillin can cause sensitization, which leads to a hypersensitivity reaction in subsequent exposures. Then option D, penicillin is not allergenic. Injection of penicillin simply causes histamine release by a mechanism not involving IgE or other immunoglobulin. So here we need to find out the mechanism of penicillin, that is a mechanism by which it causes the hypersensitivity reaction. So here the correct answer is option B, that is the penicillin must bind to a larger molecule resulting in a complex that the body sees as a foreign antigen. Although many patients inaccurately report an allergy to penicillin, a patient who developed urticaria following exposure to penicillin likely does have an allergy and should not be exposed again without being tested first. The penicillin molecule by itself is too small to be allergenic. According to the Hampton hypothesis, such drugs likely bind to proteins or other macromolecules that the body then recognizes as foreign. Now, let's see the other options. Option A, the liver plays only a minor role in the elimination of penicillin. Most is excreted unchanged in the urine. The metabolites that are formed are not known to be particularly toxic. Then the other options. Option C is not correct because penicillin itself does not cause an immune reaction. Only after binding to a macromolecule does penicillin become allergenic. Then option D, morphine is an example of a drug that causes histamine release not involving immunoglobulin. This has not been demonstrated with penicillin. Next one, a 66-year-old woman with chronic bronchitis who has smoked 2 packs of cigarettes per day for 50 years would like to quit. She has tried to quit 5 times in the past but felt she could not go long without a cigarette. The nicotine in her cigarettes stimulates many cells in her body by binding certain receptors, which describes the response when nicotine binds its target receptor. The options are: a channel opens and negative ions flow into the cell, a channel opens and positive ions flow into the cell, Adenyl cyclase is activated to increase intracellular cyclic AMP. Adenyl cyclase is inhibited leading to decreased intracellular cyclic AMP. Phospholipase C is activated to increase intracellular IP3 and DAG. So here the correct answer is option B, that is a channel opens and positive ions flow into the cell. Nicotinic cholinergic receptors are ligand-gated positive ion channels. They are so named because they are the receptors that the drug nicotine binds. They are found on the muscles at the neuromuscular junction, which is of the NM type, and in the postganglionic neurons in the autonomic ganglia, which is the NN type. When acetylcholine or nicotine binds the receptor, the channel pore opens and the positive ions flow through it. Although some potassium ions leave the cell, far more sodium ions enter the cell and net effect is depolarization. Question number 24. A medical student is evaluating the effects of two alpha-1 adrenergic agonists in a rat-based model. Agent A is a short-acting agent with a half-life of 4 hours. Agent B is a long-acting agent with a half-life of 12 hours. Which of the following effects would be most likely to be observed at 2 hours after administration of both agents? The options are decreased peripheral resistance, hypotension, meiosis, urethral sphincter closure, vasodilatation. So here the correct answer is option D, that is urethral sphincter closure. That is, the alpha-1 adrenergic agonists have the following effects: closure of urethral sphincter and increasing the peripheral resistance. This will lead to an increase in blood pressure, that is hypertension. The ophthalmic effects of this agent include mydriasis, which means dilatation of the pupil. Next one, a 54-year-old man hurt his lower back while lifting his garage door a month ago. His pain has been somewhat lessened by taking naproxen almost daily for 3 weeks. He began to have epigastric pain with meals 3 days ago. Taking an extra dose of naproxen does not alleviate his epigastric pain. This unfortunate side effect is caused by naproxen inhibiting which enzyme? The options are COX-1, COX-2, lipooxygenase, phospholipase A2, thromboxane synthase. So here the enzyme responsible, or the correct answer is option A, that is cyclooxygenase 1 enzyme. Gastric mucosa is protected in part by the actions of prostaglandins produced from arachidonic acid, in part by COX-1. COX-1 is constitutively active. That means it is not activated by inflammation. COX-2 is mainly activated or mediated by the inflammation or chronic diseases. Both COX-1 and COX-2 make prostaglandin H2, the direct precursor for other prostaglandins as well as thromboxane. Prostaglandins act on gastric mucosa to decrease acid secretion and increase mucus production. COX-2 or cyclooxygenase 2 is responsible for prostaglandin production during inflammation, and it is the intended target of NSAIDs. But most NSAIDs, including naproxen, inhibit both COX-1 and COX-2, which means they are non-selective COX inhibitors. Now let's discuss the remaining options. Then option B, that is COX-2 is inhibited by naproxen, but this enzyme is a primary target. Inhibiting COX-2 does not constitute a side effect in this case. Then option C, lipooxygenase uses arachidonic acid to make leukotrienes. This enzyme is not inhibited by NSAIDs. Then option D, which is phospholipase A2. This enzyme cleaves membrane phospholipids to provide arachidonic acid for the COX, lipooxygenase and thromboxane synthase enzymatic reactions. It is inhibited by glucocorticoids. Then option E, thromboxane synthase is found in platelets. This enzyme itself is not inhibited by NSAIDs, but NSAIDs do block production of thromboxane synthase substrate prostaglandin H2 by inhibiting COX enzymes. So we have completed today's question discussion series. Thank you everyone for watching this video. Please like, share and subscribe. Have a good day.